Hey, Robert Wilson here from the BrandTastic Podcast. Today I'm excited to have Doctor Joe from the Comprehensive Medical Center in both Edison and Monroe Township, New Jersey. We're going to learn about Dr. Joe's upbringing in Carteret to where he's at now. So without further ado, let's meet Dr. Joe.
Welcome to the BrandTastic Podcast with your host, Robert Wilson.
Hello, everybody. Today, podcast, we have Dr. Joe, who serves as an executive director at the Comprehensive Medical Center located in both Monroe Township and Edison. You've had a career over 30 years, and your experience is chiropractic medicine, and you played a pivotal role in establishing a multi-specialty facility that focuses on orthopedics and pain management, correct?
Yep, that's correct.
Great. So how long were you at this facility for in Monroe and Edison, or?
Monroe, this is our 15th year in Monroe, and 17 in Edison.
Oh, nice. And you grew up in New Jersey?
I did. I grew up in Carteret, New Jersey.
I love those towns like Carteret. There's always, I was talking to a friend the other day who lives in Jamesburg. There's always those characters in those towns, and it's really often a great place to kind of grow up. And
yeah, no, it was a really good upbringing, small town. I think it's 4 square miles.
Yeah.
Two of it's residential, maybe a population of 20,000.
Yeah, you still keep in touch with a lot of the...
I do.
Yeah.
Well, Facebook helps.
Yeah, I know. It's funny, and it's so funny because it's you know people so long in those small towns. I grew up in Monroe, and at the time it was a small town. There was only one section built, and everybody, it's almost like you can't like fool each other. We all know who each other are, and it's a lot of fun.
And I'll tell you a funny story. One of my first patients actually introduced me to my wife. We're married 25 years, and it's actually, she's going to be 90 this
Oh, wow.
We're going to her 90th birthday party. Yeah.
Wow, so that's great. Yeah,
still have good.
Yeah, all those connections are a lot of fun. So growing up in Carteret, at what age did you decide like you wanted to be a chiropractor or in the health field industry?
It's funny. People, may not believe it or not, but it was in 6th grade that I said, this is what I want to do. And, from that point on, I was just super focused on the sciences.
Oh, really? Okay. Yeah.
By the time I got to high school, I made sure I had all the sciences that you would need to prepare for, undergrad. So
sure.
It was fun.
Yeah,
I can't complain.
Did you have like any influences or anything like that? Like anybody in the science, or just something that you gravitate, like some people do, sports or anything else?
There was a few different influences. I had I was definitely was involved with sports and had been treated and with some good success with chiropractic. What's interesting is that my mom had worked with many different doctors, not in a multi-specialty setting like we have.
Sure.
But over the years, she worked with surgeons and internists and chiropractors and neurologists, and that probably that gave me that edge to make the decision what direction I wanted to go into, and that's where I went.
Yeah, no, that's interesting that you knew at a young age what direction you wanted to go. So during your high school process, you realized what avenues did you take after that, like picking out colleges locally, or?
I knew I had to do a program, based on like biology. Like you had to pick a biology major.
Right.
I don't think they had anatomy at that point. But yeah, so I had applied to Stockton, Rutgers, and Montclair. And it wasn't until my senior year, like April, like right before you had to make that decision, that I found out about Bloomfield College. They had a pre-chiropractic program.
Oh, wow.
Yeah, so it was all set up, and it wasn't even a question. That's I applied and got in, and the rest is history.
Yeah. How much, when you go to a college like that, in a specialty field, how much after you're done, how well prepared, how much more continuous education do you need? Because I know, like, I deal with these marketing students and right out of college, because I do marketing, and they usually have a marketing person on staff, and sometimes, at 23, 24, I'm wondering, what do they go to college for? you know what I mean? Like,
and I try to discuss this with my kids, but the specialized today is, I think there's an advantage. If you're going into marketing, there's so many different avenues you can go into. So if they don't pick that that area and master that area, they may struggle.
Right. Yeah.
They may struggle.
Yes.
So you got to find that what's their niche, what is their their calling, where exactly do they want to be, what industry, right? Where do they want to be? So
after college, what's the process of going from college and making it into a career? What was your journey like?
Bluefield, I was there back in, I had to be in 88 through 90, 91. I did all my sciences in probably 2 years, and I was able to transfer out. I went down to Life University in Marietta, Georgia.
Oh, wow.
Down there for almost I think, a 4-year program.
How was that?
It's hot. But it was
coming from Carteret to
it's beautiful down there.
Sure.
And very mountainous.
Yeah.
I did a lot of mountain biking.
Oh, wow. Good for you.
A lot of running. They had a Chattahoochee River.
Nice.
So it was definitely a good experience. But that transition from college to the reality of the real world, it wasn't too bad, because I had some support systems.
Oh, you did?
Yeah, I had some great support systems.
Who were they? Who was this?
Some of the doctors that my mom had worked with over the years.
Oh, okay.
So it wasn't as it was a lot of hard work, but it wasn't as tough as a transition as some people may face.
Yeah, I always talk about that, how when you don't have a blueprint and you have to make that all yourself, it's good to have a little bit of a support system, that somebody who already went through it, and often you have to seek that out. So it's good that you kind of had that for you. And then what were some of the biggest challenges going from that transition? Were there any big challenges, or like you said, was it mostly pretty smooth? Where was your first job? And
the challenge, for any new provider that's coming into the field is gaining that trust with the community. And once I invested my time into these individuals and showed them the type of care that we would be able to provide. It just evolved. It was you just have to be present with them and focused on what's happening with them, what their needs are, and things fall into place.
Then when you decide to start comprehensive medical care, what was that like? Like, what was?
So I think I might have been about 7 or 8 years in private practice, and at that point I realized that the patients I would have to refer out because they may have been more advanced. Mm-hmm. If we look at spinal cases, sometimes individuals that advanced degenerative changes, chiropractic, helped, but it didn't get them over the edge. So it required me to refer them to another specialist to help.
Right.
And once I realized, the benefit that the patient would have by having it in-house for efficiency,
Right.
for time. We were able to turn around, get that patient seen in a much more, faster way than, saying, okay, here, I want you to go to this doctor, and, they're not scheduled for 2, 3, 4 weeks sometimes, and then sometimes you never see them again. Sometimes, they would be not happy that it took so long, to get the services that they needed. So that was the real push to bring these other specialists in-house.
Yeah, and there's really no way of having the proper communication between everybody. And now with everybody in-house, I mean, that's the multi-specialty part of it, which is, do you feel that's where what you do as an industry is going, more of a multi-specialty type of thing, or...
Well, when you look around, it appears that the hospital systems,
yeah, I've noticed
are
that
buying a lot of the practices.
They are.
So in a sense, they're becoming more of a multi-specialty conglomerate.
Sure.
So they I'm going to say the hospital, being in a hospital, obviously they have all different specialists in there, but then now them going out and buying all these other practices, they're increasing their market space for that type of work.
Yeah, I noticed that with my cardiologist. It's Robert Wood Johnson Hospital. They still have their own separate branding name, but the billing is all kind of, and my primary care doctor was with Meridian Health now, and just kind of buying everything up. You mentioned wait times before, and I know that's something that you're proud of.
Yeah, I mean, there's nothing. Our systems are set up so we could, get these patients in a timely fashion, get them seen, get their, if they need diagnostics.
Sure.
There's no, 1 or 2 day turnaround time to get approvals for, say, an MRI.
Right.
Versus, I'm hearing from, patients that come in that they had to wait a month to get it pre-certified. So our team is very strong, and, if I'm with a patient and, I call my pre-cert department, I say, hey, I have a patient here right now. This is what's going on. They had this treatment. They were taking, this medication. They're not, they had this therapy somewhere else. They're not getting better. Now they're here with us. We need an MRI. They're on the phone, and, they're 9 out of 10 times before that patient leaves, that MRI is approved.
Yeah, and that's really important, because we're all so busy, and sometimes, I mean, it's just time consuming when you have a hectic day just to make getting those appointments set up. So you're like a facilitator there too.
We understand that, patients, yes, they're busy, and to have, and because we're in the rehabilitation business, it requires time. And
sure.
Looking at, if on average, if somebody comes in with a, some type of neurological symptom, a deficit, that could be a 3 to 6 month course.
Wow.
Right. A 3 to 6 month course. So there's an investment of time there. But, those are for the more advanced, individuals, more advanced degenerative problems that present to us.
Yeah, no, that's, sometimes I just dread, I have a specialty pharmacy. Sometimes I dread just calling them because it's a half hour. Mm-hmm. You know what I mean? By the time you go through all the questions, double checking everything, so that's a really great advantage of you guys doing that. Can you talk a little bit about your team composition of
Sure.
of your staff and
Sure. Our medical director. Mm-hmm. Is Dr. Mills. Dr. Richard Mills is a neurologist. So he's been out maybe 35 years, 40 years in practice.
Oh, wow.
So he's our medical director, our head chief. And then we also have, our medical team is made up of physical medicine rehab specialists. And these are medical physicians that are trained in pain management and neurodiagnostics, like EMGs and nerve conductions. I'm not sure if you're familiar with those types. Those are determined. Those kind of tests determine the extent of the nerve injury. They help determine whether somebody may require some type of surgical intervention. Pain management physicians. So we have a couple anesthesiologists that are on staff that, for those acute cases that present that may require epidural or
set injection. And you do that right there.
We could do it right in the office.
That's amazing.
Yeah. Efficient.
Yeah, absolutely.
And then our rehab team. We have our rehab director, Dr. Michael Lieberman. He oversees our physical therapists, our chiropractors, our occupational therapists, and acupuncturists.
Oh wow, yeah. So, what? There are the obvious things that kind of set you apart from a lot of other facilities. What other things do you feel that separate you?
Some of the tools that we have access to, right?
The technologies.
Yeah, and technology like our non-surgical spinal decompression machine for neck and low back problems. It's a DRX 9000.
Yeah, what's that about?
For individuals that have whether neck or low back, facet problems or disc herniations, cervical lumbar radiculopathy. That's where that disc sometimes pushes on that nerve that comes out of the spine. Very effective. If they're a candidate, now it has to do. We have to make sure that everything's stable, so that'll require some X-rays.
Sure.
Right, for stability films, and then we have our lasers. Class 4 lasers are very effective.
What does that do?
The lasers, they emit light. Essentially, it emits light into the cell.
Wow.
And it stimulates that mitochondria to basically increase ATP production and to help with the cellular proliferation. So, to regenerate those tissues.
Yeah, I think I've seen that down. It's like you kind of circle around a certain area. Is it like a rejuvenate?
Yeah, you could target. It's a handheld instrument that that emits that light into, and it's a little wand that you place over the region of that's compromised.
Sure. When a patient comes in, how do you know? What do they start with? Do they start with X-rays, depending upon
We start with the history.
With the history,
we need as much background. What for the whole life. You'd be surprised that when you start talking to patients, they think, oh, it just started. I never had this problem before, right? But then then you get to the X-ray, if it's necessary, and you'll see that the problem was there for 2 or 3 decades.
Sure.
And sometimes they're not symptomatic, and then they do something that triggers it, and now they're there's pain, and from there we make a determination whether they're a candidate for this type of services that we do, and then we get to work.
Yeah, and sometimes I know for me, you just think it's normal. Like you get so used to like being a little crooked, and then like trying to straighten yourself out, and you just you don't realize that you're not supposed to be in pain all the time, because it's gradual sometimes.
That's the warning sign, right?
Yeah. What are some of the most popular or instances of cases that people come into you for? Is it back pain? Is it shoulder pain? Or
back pain is probably number one. Back pain, low back pain, and then with low back pain, you get knee pain. Sure. So we got to look at the kinetic chain. So if somebody's coming in with low back pain, you want to, the assessment should include a movement pattern analysis to identify what muscles are functioning properly, which ones aren't, because if there's imbalances in those tissues, it's going to affect all the other structures. So we start there. As we get the history, we do the physical exam. You may have to do you may need an X-ray. Many times you do. the technology today too is the radiation. It's very, very minute radiation compared to from years ago.
Yeah,
the technology is much more advanced. And then and then you put the care plan together. And depending on what their issue is, then we look at what specialists they should be set up with.
Right. Yeah. I know you're very proud of like the seamless patient experience. Like how easy is to, if somebody's in a lot of pain, to get them fit into your schedule?
We'd like to get them in the same day.
Oh, really?
Yeah.
That's unusual.
If you're in pain, let's get you in today.
Right.
Let's get you out of pain.
Yeah. And also, I guess sometimes you're in a lot of pain today, then the next day you're not. But then the next day after that you are again. So it's better off getting them in.
Depends on the activity, and and depends on how long it's been going on. So if it's been going on for months, you may be causing more damage.
Yeah.
If you let it go, if you let the problem go, then you're going to deal with a bigger problem, and the recovery is going to take longer.
Yeah. I mean, somebody who I suffered with back pain. Probably I was hit by a Jeep, actually, by your office.
Is that right?
On Englishtown Road when I was 12.
Really?
On a bicycle. So I have experience. But how much of it is people just not exercising, or they're too... I know that's not all of it, but for me, I know when I'm in the gym doing the right things, a lot of my issues aren't as bad, or they don't react as often as they usually do.
Yeah, we have a sedentary population.
Sure.
So it's probably maybe 10 to 15% of those individuals that are doing a daily or weekly regimen of some type of exercise, and then that's why we have this. I'm going to call it an epidemic.
Sure.
But it is an epidemic of obesity.
Absolutely.
Right. Obesity, diabetes.
Yeah.
And
inflammation, all that.
Yeah. That's why, nutrition, what you're intaking is critical to how you're going to function as well. So I've been studying the gut microbiome.
Oh, right. Yeah.
When we talk about the gut microbiome, we're talking about, what bacteria is thriving in there. Mm-hmm. So there are tests that could be done to determine what's growing, and then you want to try to fix that.
Yeah.
With prebiotics and probiotics, because if you talked about inflammation, so when we look at the gut, you're looking at 60 to 70% of your immune system sits in the gut.
Wow.
Okay.
That's amazing.
So when you eat something that's not good, your body's going to react with this inflammatory response.
Right.
So that's why we need to be very selective and try our best to avoid things that are going to lead to that chronic inflammation and lead to ultimately to possibly autoimmune disorders, right? Because of leaky gut.
Yeah, it kind of goes back to you are what you eat. Yeah. It's so funny you talk about obesity. I listened to a guy, his name is Rich Roll. He's a vegan ultra athlete, but one of the things he said, and I live by every time I need to drop weight, is I change my relationship with food. It's no longer enjoyment, it's fuel. Yes. To do what I need to do. And I think that's what a lot of people have to learn. You just got to change your relationship with what you put in your mouth. And
it's not difficult.
It's not.
It's not difficult to understand what you should be and shouldn't be. Mm-hmm. But you have to have that want.
Yeah. I became more empathetic for people who struggle with it because they're good at stuff that I'm not good at. When I decide to shut it off, I can shut it off. But some people, they can make a lot of money easily, right? Or they can do other things easily. They can have great relationships easily, but sometimes we all struggle with different things.
It's a challenge.
Yeah, it's a big challenge. Talk a little bit about the financial flexibility that I need. So do you work with insurance companies then, and then if they don't have insurance or they have an issue with their insurance, you have some other options for people?
Sure. Yeah. There's, we deal with, all the major medical carriers like, Blue Cross Blue Shield,
sure.
Cigna, United Healthcare, Medicare. But then once, sometimes we come across individuals that don't have coverage. So, we'll set up, a cash type of plan with them, close to the Medicare fee schedule.
Mm-hmm.
That's probably a very reasonable, amount that they would be able to afford,
Right.
And, and then there's, if there's hardships and stuff like that, then, we could be even more flexible.
Sure.
So it's a case by case, but, if there's insurance involved, today's day and age, you're dealing with both in and out of network deductibles,
right?
Higher co-insurance and whatnot. But from day one, we you take your oath, do no harm. It doesn't just mean physically, financially as well. So
sure.
we try to aim to please, and get those individuals the care they need at a reasonable price.
It's funny. I do marketing for a drug rehab place in Texas, and it's all about how to code everything, knowing the codes.
Yeah.
It's almost like they take the fun out of the craft sometimes.
It's a never ending adaptation.
Sure.
And the plans, they change from year to year.
Yeah.
And you could have a patient that requires a visco supplementation. That's a gel that gets infected into need for severe osteoarthritis. 1 year it could be, I could say no 1 year, 1 month it could be, this drug, and 4 months from now, this insurance company doesn't cover that drug anymore.
Right.
And this drug.
Yeah.
And if you don't keep up with this.
No, I'm on a specialty drug for psoriasis, and every year I get worried. I know I'm going to be covered, but I miss injections because of just trying to straighten it out with the insurance company, and the new specialty pharmacy. They have an advocate for you, at least. You need these advocates to kind of help you go through these murky waters.
Well, that's one of the benefits too with a comprehensive.
Sure.
We have a great support staff. We delegate, a accounts receivable individual to the patients.
Oh, wow.
They'll reach out to the patient when they first start to let them know that if they receive any, mail, any letters from the insurance company, if they need help understanding what's going on, then they're there to help support them.
And it's so important when it comes to insurances. Some people who may be very smart at other things with insurances, it's so difficult to navigate through if that's not your interest or you don't have the patience for it, and it will prevent you from actually getting treatment sometimes if that part is hectic. Yeah. One thing I was going to ask you before, so you have two locations. Your Monroe location was first, was it? Or
no, Edison.
Edison was first. What was that like opening up a second location? Was there a need for it? What kind of mindset did you need to? I mean, that's a big undertaking.
Sure. We were, in the expansion mode. We were thinking expansion. Our caseload was, we were pulling individuals from all over. My first location was Carteret. I told you that earlier.
Sure.
But I was there in that location for 20 years. But it was very busy there, and I think it was like a 4,000 square foot space.
That's a nice size space.
I actually wanted to. The company we purchased a building next door because we were renting space in Roosevelt Ave in West Carteret, and we bought this building. It was Old Diner. I don't know if you're familiar with Carteret.
Sure. Yeah.
All right, and we purchased it. We started cleaning out. Then the mayor decided he wanted to build a hotel on it. So that didn't work out.
Right.
But that's why I had at that point we were already in Monroe too. So we were growing exponentially in Carteret, and then moving to Edison helped take some of that load off.
Right.
So, and then Edison got really busy. So it's the service, the type of service that care. I'm very tough. I'm tough. I'm tough on the staff because I want to make sure that our patients are being properly taken care of.
Oh, absolutely. One of the things I love about comprehensive medical care is your transition program to New Jersey Fast. You want to talk a little bit about that?
Sure. Yeah. For a few years back, the NJ Fast is it's the sports performance piece, that we had started. Now I had just started working with John,
mm-hmm.
and I said, John, yes, you can start this thing up again.
Right.
I couldn't find coaches.
That's unbelievable.
Couldn't find staff, and I was primarily focused back on the medical after the pandemic, because that whole pandemic was disastrous for everybody.
Sure.
So we're getting back up to speed. So John's going to be up there with Alex, and get that athletic program going for the kids. And, not just kids, for adults as well. We'll do group trainings.
Sure. The weekend warriors.
Yeah. So, yeah, that's going to be a great, we just had the grand opening. It's going to be a great thing to bring back to the community. And, and tie that into our sports medicine division, our fast sports medicine program.
Yeah, and it's great again that the communication everybody has with each other. It's funny, when I followed New Jersey Fast page, there was a lot of my friends were right. like 20 of them. So you had a nice following. I mean, at one point, and the pandemic. What a lot of people don't realize is, who work in the corporate world and went uninterrupted during the pandemic, was they thought it only lasted a few months or 6 months, but for a lot of us, including myself, the pandemic, I'm still recovering from it years later. And it wasn't always, not everybody bounced back as quickly, but you just continue to do the right things and stay on track and
put the work in, right?
Yeah. And sometimes it's just, for me, was reinventing myself, a little bit, and taking that opportunity of time I had and to learn other things. So, it ended up being a good thing.
Yeah.
So you kind of have to make the best of things. Now you guys focus on whiplash and traumatic brain injuries too? Or one of your focuses?
That's one of the focuses, sure.
Yeah.
We talk about whiplash, talking about individuals that primarily are involved in motor vehicle collisions. So we treat, there's really not too many things that we don't treat.
Sure.
When it comes to orthopedics. You'll find a lot of primary care physicians, there's work involved, and when you get into the motor vehicle collision sector of healthcare, you're talking, there's a lot of medical legal aspects that go along with it. So, you're dealing with attorneys,
right,
and narrative reports. And
that's right. Yeah,
certification with the insurance company. So there's a lot of work that goes into it. But it's doable, right? It's doable, and you're helping these individuals get back on their feet. It's
I mean, what is it like working with somebody with brain injury? I mean, that must be upsetting to some part of it,
Sure. I mean, we deal with that as well with the kids and with the sports sports related concussions and stuff like that. So,
is concussion still a big thing? I remember.
Oh yeah.
Yeah. What sport or how did most of the kids?
It's in
varies.
It's in all the sports.
So it's not just football or
no. It's in soccer, lacrosse. Anytime that brain is banging against the skull, there's a likelihood of some injury there.
Yeah, that's it's nice to see that they're taking measures I coached travel basketball for years, and once a kid hits his head, he's out of the game, it's frustrating even as a caring coach and a caring parent. But it's nice that they have these policies, I guess, and it takes the pressure off the coach and everybody else who's not an expert in it, where the decision's made for you. It's really important.
Sometimes it's upsetting to see that when we come across the kids like this that have and it can be mild, moderate, but it's there, right, but when you have the parent that's pushing for the kid to go back, and when I say it's upsetting is that we say, hey, it's not time for the child to go back, and then they take the child somewhere else. And then you find out that the kid's back.
Yeah,
that's one of the toughest things to see happen. And
onto that, it's I was talking to I was part of the medical society. I was doing some marketing for them, and to your point with the opioid addiction, a lot of times what would happen is if the doctor stops prescribing the drugs, they would just go to another doctor. So they'll just find somebody else to give them what they want, and
they're closing in on that because because all the pharmacies are tied in, and we get you get a report, you'll get a fax.
This was 5 years ago, and they started closing in on it.
Yeah.
So it's the same thing. They just find whoever they want to get the right answer.
That's we do pain management. We're not treating patients chemically,
right?
So we'll do injections. I'm not going to say that the docs don't prescribe an opioid.
Right, as needed.
It may cover. If it's a new patient comes in and they need a procedure like an epidural or a set injection, and they're that much pain, we can't get them into. Say their insurance requires a pre-authorization, we got to wait a day or two for that to be approved, and then we schedule that, whether we do in the office surgical center, they may prescribe something to cover, just that short span of time.
Yeah, the sad part about all that is I know somebody with MS, and they were having a difficult time getting their pain medicine because of all the shenanigans that were going on. So, all that technology, all that medication is good when you need it. Mm-hmm. Absolutely. So what's the future for comprehensive medical care?
Yeah, as we adapt and adjust to this ever-changing healthcare industry, integrating more nutrition, right? That's huge. And when you look at nutrition too, you'd be surprised. And I can't remember the name of the book, but the name of the author was David Seaman. It had to do with nutrition in joints.
Okay.
And you hear stories of, it's from the job, it's wear and tear over the years. Yeah, that's part of it. But surprisingly, the research is showing that, certain foods are destroying the cartilage in the joints too.
Right. Yeah.
So, so my focus, not my entire focus, but my focus will be, continuing to push for, nutritional counseling, looking at gut microbiota. We may even get into the genome, like the genetics, because if we don't straighten the gut out, and you're living with this chronic inflammatory process, your body's not going to, work at it. It's not going to work at it's not going to be able to peak at that high level.
Yeah, I'm curious, how much does alcohol play a role in a lot of this stuff? Because I know for me, I'm on biologics. I have a couple stubborn spots of psoriasis on my shin. I haven't had a sip of alcohol in 4 or 5 months, and those spots aren't coming back anymore. It was right in line.
Well, we know that alcohol is toxin.
Yeah. I don't think people really understand that it's not a
toxin.
That's what it is.
Yeah, if you see, I was watching Andrew Huberman. He was talking about.
Yeah, I love that guy.
About 1 to 2 drinks a week for those individuals may be okay.
Right.
But for your the daily drinkers or the weekend partiers.
Yeah.
It's destructive.
I find it amazing when I go on my Facebook how many people, everything revolves around alcohol. Like it's all, every picture on Facebook, they have like a drink in their hand, and their kid has a fake alcoholic drink. But I don't even think that's like all the time a good visual to teach kids that, every time that there's a celebration or something bad, you celebrate. So wrap it up. I have one more question. What kind of advice would you have somebody getting into your field if they're just finishing college, or what? Sure. How has things changed, or if they have changed since you finished up?
Yeah, I mean, for me, my growth has come with the continued effort in learning, right?
Right.
So that process should never stop.
Of course.
Coming out of school, the mindset shouldn't be that, hey, I'm here, I have my license, and it's a tough thing to say, but sometimes I think the younger people that are coming out, they think it's over. They think the work is done.
Right. Yeah.
They think the work is done because they got their license, and I try to instill in them that you need to keep pushing. Use the same energy that you did to get through these programs at school in your new positions, because it's just going to make you better.
And I know, like, for somebody like you who went through the process of entrepreneurship is a whole other learning curve. So you become an expert or close to an expert of working on people. Then there's a whole other thing of if you want to build a business or not.
Yeah, that's interesting you say that, because last year I've been reframing. I've been reframing. My intention, going forward in the next 30 years is going to be, to find those individuals that want to be leaders.
Okay.
Because the struggle, with individuals that are just there, I hate to say just, for a paycheck, that's something that I just can't tolerate. And, if you want to come into, I tell them right up front, it's not going to be easy.
Yeah.
It's not going to be easy.
It's a lonely world.
It's going to be work, so we're going to support you. We'll support you, but you're going to need to put that, have to put that energy in.
So if you hire somebody knowing that they might want to go the entrepreneurial route right away, that doesn't bother you. And you kind of, I don't know if you listen I had a few docs that I work with, they were with me 5-7 years that they just got it. They wanted it and sure.
That intention to be able to grow, and great people. And I'm still in contact with them. They have their own practices and whatnot. Yeah. But while they were working, while they were part of the practice, they were, outstanding.
Yeah. You hear some business owners, they don't want to train their competition, which I think is a terrible way to think, because if you find people that continuously want to move on and get to the next level on their own, you're always going to find good people to work for you.
Yeah, absolutely.
Yeah. But no, it was a pleasure, Dr. Joe. I really appreciate it.
I appreciate you having me.
Yeah. So where can people find you? Through Facebook, Instagram?
Yeah, Facebook, Instagram.
Comprehensive Medical Care.
Yeah.
And
website.
Pop up, and I'll have all your information for everybody to find you. So I really appreciate it.
Yeah, I appreciate it.
Thank you.
Thank you very much.
All right, buddy. Thank you.